Hey everyone, it's Nurse Dani coming to you live, and I'm really excited about today. I have two very special guests, and they're going to help us talk about exercise during pregnancy. We have Shauna Cheshire, a registered nurse, and we also have Dr. Foss. She's from Wasatch OB in Layton, Utah, and also at McKay-D in Ogden. And so I want you guys to have a chance to introduce yourselves too. We'll start with Shauna.
Yes, I'm Shauna Cheshire. I have been a nurse, for half of my life, so about 22 years. 18 of that I spent on labor and delivery. And about 7 years ago, I got an additional degree in exercise science, and I decided I wanted to do personal training and work specifically with women who are pregnant and postpartum. So that's what I started to do about 5 years ago. That's me.
That's awesome. And Dr. Foss, when are you due?
I'm due November 25th, so
That's
I'm
so
28
exciting.
weeks. This is my second baby. So, and I really wanted to keep my fitness level up this pregnancy, so I've been working with Shauna since about 14 weeks, and it's been
That's
awesome.
great. How fun
Just
for
been
you
having a great
guys.
time. So
She's like the best client ever. So,
Well, and even better for us because we have a doctor in the house too. And so if you guys want to ask questions during the live stream, we'll get to some of those at the very end. So let's start out by talking about the benefits of exercise during pregnancy, and we'll kind of end with showing some exercises that you can do during pregnancy. So, Shauna, first of all, tell us, why should a woman exercise during pregnancy? To some, that's not obvious, especially in the first trimester when you're feeling so sick. What is the benefit?
well, in general, just having a healthy routine of exercise and working out, obviously your fitness level is improved. And so if you want to kind of think about pregnancy as the prep period to this big athletic event called labor and delivery.
Like you're prepping for a marathon.
Exactly.
Right?
So
You can't start the day before and expect it to go well.
Right. So if you were to register for an event with a friend, it's 6 or 9 months away, and you never spend a day in training to prepare for it, it's kind of not really, smart to assume that it's going to go super great and that you're going to feel really great going through it if you haven't prepared your body for it. So that's one thing. And most women who are pregnant and exercising routinely, and I've seen this with my clients who haven't exercised previous pregnancies but are during this pregnancy, is just how much better they feel carrying the pregnancy overall. Every woman's different, but the clients I've dealt with have said, I have so much less discomforts in general. I just feel a lot better at 38 weeks than I did before.
That says a lot because with each pregnancy, you're older and your body's a little more worn out. And so pregnancies generally get harder. But if they're saying that they feel better when they're exercising, I think that says it all. Plus, a woman should do whatever she can to control the amount of weight she gains during pregnancy.
Definitely.
And exercise helps with that, right?
that's one of the biggest reasons to exercise during pregnancy, is to not let that weight gain get over the recommended amount, which for normal weight women prior to pregnancy should be 25 to 35 pounds for the duration of pregnancy is how much you should gain. And if you gain more than that, then that adds additional risk to your pregnancy, which you definitely want to avoid. So.
Yeah, and I know the most common ones are preeclampsia risk is increased, gestational diabetes risk is increased. I can't think of any others. Those are the two main ones.
Even the risk of C-section is increased if you gain above the recommended weight gain goal. Yep.
Yes. And affect the size of the baby can be affected. They may be low or they may be high on the scale. It can affect them in both directions. So important to gain the appropriate amount of weight. Exercise helps, of course, diet too.
Right.
So, if I have been exercising before, say that I just found out I was pregnant and I've been exercising regularly, but I'm like, well, gosh, I've been doing CrossFit, I've been training for a marathon. What activities can I continue with once I get pregnant?
Assuming you're one of the lucky ones that doesn't feel really sick or nauseated during the first trimester and you feel good enough to just keep going, there's no reason to drastically alter what you're doing, especially if you've been doing it for a while. There is usually a point in pregnancy, though, where most women feel like they have to modify what they're doing for comfort. I generally feel like there's a few things, even though they may have been doing it pre-pregnancy, I would eliminate in the third trimester, but that's just me.
Like what?
I think, it always makes me cringe to see like these pregnant women doing these huge Olympic lifts overhead with the bar.
Well, and abdominal
just call
trauma
out
is
and
an issue. Yeah, and if you have like bad form because you're having a weak moment or something, what if you hit your belly or caught it on the way up or something?
Your back is so vulnerable at this time. I just think there's a lot of things you can do to keep fit that minimizes risks of those type of movements. But I know some women have done it and do really well. Maybe they've done CrossFit for 3 years and they feel confident in their body's ability to execute that. But
It's just not the time to push yourself or increase weight. You're maintaining.
Right.
Yeah.
But I do feel like clients that I've worked with, if they started maybe as low exercises or sedentary to start with, have actually seen some fitness gains during pregnancy. Their strength and their muscles improves. Maybe not a ton of like cardiovascular gains, but muscular gains. Definitely see that. And so
a lot of people think that you only should do cardiovascular exercise, but let's talk about that for a second. What are the benefits of intermingling strength training with a cardiovascular program?
Just as good as they are for everybody else. We know you have to be balanced. It's good to be balanced. It's good to have good cardiovascular fitness. It's good to have, musculoskeletal fitness.
And so you don't have to be afraid of weights. Just do the right amount, the right number of reps, and work your way slowly up if you haven't already been doing it.
Exactly.
You should be fine.
Exactly. And as we do some things, as we do the exercises, I'll maybe point out some things that would be good to modify as you get further in the pregnancy. We'll talk about those things. But really, in general, there's so much that women can do with weights and bands, resistance exercises in general, just your own body weight that will really help with your muscular strength and endurance, which is really important because as a mom, don't you use your muscles like all the time? You're hefting this carrier around with you.
I think I was the strongest I've ever been during the first 2 years of my son's life because I had huge guns, man. And then after he started walking and being more independent, I gained a few pounds because I wasn't carrying him everywhere. He was 30 pounds. Yeah. So yeah, definitely you need to be strong. And it helps you when you want to get the pre-pregnancy weight off after.
Postpartum recovery. I mean, I was so surprised after my first baby, how deconditioned I felt, and then starting to exercise afterwards. I think that's my primary motivation for exercising more during this pregnancy, is hoping that the postpartum recovery won't be quite as hard.
Yeah, a little easier, a little faster, feeling like yourself again.
Yeah, you're getting back to your daily activities quicker. In general, just feeling a lot better sooner, and they've shown through research that women are more able to recover their pre-pregnancy weight more quickly, mostly because they probably haven't gained as much because they've, mitigated that excessive weight gain with exercise. So there's so many important parts for mom. But there's so many good things that are specific for the baby that research is finding too.
This is so interesting to me. So yeah, we talked all about mom. Tell us about baby.
So what they've done, a lot of research to say,
don't do it for yourself, at least do it for them.
Right. A lot of times moms are motivated for their little one in here. Things that they wouldn't do for themselves, they'll do for the baby. So some things that they found that the baby benefits is with your exercise session, as your heart rate goes up, they have heart rate changes too. And at first that seemed to be a concern. 30, 40 years ago, doctors weren't necessarily really encouraging exercise in pregnancy. They weren't really sure what effects it had on the fetus. So there's been a lot more research in the last 10 to 20 years. And what they found is babies have a heart rate adaptation. Just like when you get conditioned with good cardiovascular fitness and your resting heart rate lowers, they found that a month after they were born, they compared babies of moms who were exercising throughout pregnancy and babies of moms who were sedentary, and they found distinct baseline heart rate differences between the two groups.
That's so interesting.
So, not that their heart rate was ever dangerously low, but their heart was just conditioned to pump more blood with every beat, so they could move the same amount of blood around with fewer beats, which is what happens with us. Yes, the contractility
a little
increase.
More frequently. It contracts a lot less frequently.
Yeah, so that's been shown. Labor, I think, as I'm using my scientific mind, they've shown that women who have exercise during pregnancy have less periods of fetal heart rate problems during labor.
So let's go back to Physiology 101. They get blood flow through the placenta, and anything that affects blood flow through the placenta or an umbilical cord is going to affect blood flow to the baby. So
it can tax their reserve a little bit.
Body affects the baby.
So So what it seems to be is newborns that have moms who have exercised are maybe more prepared with more reserve to go through some of the rigors that labor may present. And so there's
lower nature is stressful for a baby.
Right.
You know
it's no picnic. Yeah. I mean, for moms, we know we can't really interview babies after birth to know how they felt about it, but I'm assuming it wasn't a picnic for them either.
They're telling us about it.
Exactly. So there's that. And then there was a really fascinating study that's pretty recent that compared EEG findings with babies that had exercising moms versus sedentary moms, and they actually found some differences and changes. So it sounds like the increased cardiovascular flow during exercise benefits the heart and the brain. And so I think that's amazing if you can give your baby a healthier start. And then they're extrapolating out that babies who are exposed to prenatal exercise may have benefits that can go into their lifespan. So lower rates of chronic disease, obesity, those kinds of things. So it really does set your baby up for the healthiest start possible.
And you set a good example by exercising not just during pregnancy, but after too, during the postpartum period and for the rest of your life.
Exactly.
Yeah. So let's talk about some of these exercises. So show us some things that you can do.
Okay. So I was trying to think, how can I deliver something to you guys that are watching that's going to be consumable and easily integrated into your life? And so lower body and upper body, we often separate those. And when I work out with women, we're usually doing like an hour session and we do a total body workout. But for you guys that are at home, you've got 20 minutes. You don't need to do a ton. The baseline minimum recommendation is 150 minutes of accumulated exercise throughout a week.
Okay.
So
including strength training, cardiovascular exercise all together.
Right. So it doesn't have to be in an hour package to be a benefit. You could do 30 minutes every day or 20 minutes here and 50 minutes tomorrow. I mean, because really, mothers, we kind of just have to roll with the punches a lot of times, right? We do what works. So I thought I would separate us out into lower body, upper body, and then core exercises.
A lot of people think they can't do core exercise during pregnancy, but you can. And I'm excited to have you show
And you should.
You should.
Yeah.
Your core is important. So we'll talk about that as we do that set of exercises. But I thought we'd start with upper body because I think a lot of women ignore the upper body quite often in general. But in pregnancy, maybe even more so. And they might be really quick to hop on the elliptical at the gym or something while they're pregnant, but they may not go to the weight area. Mm-hmm. So, especially to work their arms. So we're going to show a couple of things. Okay. So Cassandra, Dr. Foss, I may call her both, back and forth. So we have a basic push-up, which can look a lot of different ways. If you were not very far into pregnancy and you're previously pretty strong in the upper body, you can do the on the toes full-on push-up. If you
as your belly gets bigger, you just don't go down quite as low.
Right. And we have a little solution for this problem too.
I love this.
So if you find you could do this, like say you have at the bottom of your steps or something. So just imagine this is just a carpeted step.
So it raises your upper body so that you can still get that range of motion.
With the belly. And also this makes it a little bit easier. So what I'm going to recommend is that you take a timer off your phone or your kitchen timer or whatever, set it for 30 seconds, and you just do your best work in 30 seconds. So she'll just kind of show us a few of the motions. Great. And so this is a great modification. It's on the knees, but it's made even a little bit easier by being elevated, and because her belly's getting there, she's just starting the third trimester, it provides some room comfortably for her belly to go. So if you're really super deconditioned, you can even go against a wall or a countertop, something higher. Awesome, those look great.
Yeah, so, you just gave us 20.
I wasn't counting funny. On that one. Maybe you were. So there's that. So I almost forgot. We didn't really show the warm-up because we're getting so excited. We were talking.
But while we're on the topic of warm-up, some people are tempted to skip the warm-up or cool down.
Like we just did.
Yeah, like we just take the time. You're like, I don't have time for that. Why is it so important?
Well, we have a really, really easy warm-up. Like seriously, this is it. 1.5 to 2 minutes and you will feel it. Your shoulder complex feels it, your legs feel it. So you can do this in a really small space. It takes really not long. So I think sometimes people will like see a video's got like an 8-minute warm up and they're like, lame. That is too long and I'm not going to do it.
Of my workout.
Right?
Yeah.
So they'll be like, nope, I'll just skip the warm up. But this is a warm up I swear you have time to do. But it is important to prep the muscles, to warm them, to get them activated for what we're about to do. And so, yeah. So
Helps
you'll do
prevent
that
injury.
Yes.
Yep.
So, and it's just kind of a good signal that we're about to do some work, and it preps the muscles.
Get the blood pumping through the muscles.
Yeah, exactly. So after a warm up, then you're ready to go. You probably will get feeling burny in the shoulders, maybe in the quads, which is desirable.
Okay,
That means it's
I tell people this all the time too. Like when I taught Lamaze and teach prenatal classes, if you've exercised during pregnancy, don't you feel like you're better prepared for the pain of labor too? Because exercise hurts, and you're used to just working through it and breathing through it. And when you have contractions, if you're used to like, holding that squat for a long period of time, you're just like, this is another one of those for me. I just need to breathe and get through it. I think that mentally preps you.
Pushing through some discomfort is really good preparation. And I'm trying to teach my kids as we're doing things with them. As human beings, if all we ever do is stay where we're comfortable, we have no growth. And the same is true with exercise. You've got to push through a bit of discomfort. You don't want to do anything crazy and go way past your ability, but kind of just edging across that discomfort, pushing yourself a little bit is important. Some overload is critical to actually get any kind of training effect. So push-ups, like we just demonstrated, you do 30 seconds of your best work, however that looks. If you want to go slow and not do too many because you're like, I'm not sure, I've not done these in a long time, then just be,
record it, write it down, and then you'll know next time what you were able to do.
I only did 10 last time, now I did 14.
Yeah.
It is good. It's good data to kind of have on yourself. So 30 seconds. So then, it's important that with the upper body that we have movement in all the planes. So we just did horizontal pushing. Now we're going to do horizontal pulling. And so Cassandra, Dr. Foss, Cassandra. I'm going to just go back and forth. So she's going to step on one band.
I'm going to do it this way.
Okay. What if I don't have a band, but I have weights?
You can grab your weights.
I demonstrate that?
Yes.
Okay.
This way I do the pulse.
Yeah, and so we're just going to take one arm with the band, and we're going to just pull back. And you kind of have to play with the weight. Or the band to kind of get a resistance that works for you. But again, it's going to be 30 seconds per arm. And you should feel slightly fatigued or have a little bit of difficulty pulling back towards the end. You'll get the best benefits that way. If it's like a breeze the entire time, then you're probably not going to get
resistance.
or increase the resistance.
So I can make it like shorter.
Yes, she can step closer to the handle, which will give her more resistance.
Or I can step further away if I need less, right?
Right, exactly. So the band offers a lot of variety. Whereas if you've got just one set of weights, that's all the resistance you can get with that. But a band does offer a lot of options within that same band. So
that's great.
So you'll want that horizontal pulling.
And the muscle you're working is your back. And also your leg as you squat down.
As you kind of just stagger stance and do that. So we want to work both sides, chest and back. So that's why we want to do horizontal pushing and then pulling. So those are really important. Then we're going to move to the vertical plane. And so overhead press, I'll switch you out because I know this is the one you use for overhead. So with the band, you may find you'll need to look either for a lighter weight band that's got more elasticity in it. You can step on it with 1 foot or double feet, whichever works. But you're just going to go overhead and lift overhead. Stagger stance is better because it keeps your pelvis in a neutral alignment. You don't tend to
especially
curve
when you've already got an exaggerated curve when you're pregnant, right?
Yeah.
So stagger stance is really important. So palms forward, just extending all the way to the top, and then coming down, right hands right about the shoulder. So that's all that one is. So if you can work both arms at a time, then you'll just do 30 seconds of your best work. Let's say your band is this red one. It's the only one you've got, and it's too stiff for you to do both arms at one time. You can just step on one side and do one arm for 30 seconds and then move to the other side. So
that's great advice to modify, because a lot of times you don't have the ability to go out and buy all this expensive equipment. So I like the tips on how to make what you have work.
Yeah, because really, there's so many barriers to exercise for people. A lot of it is the equipment can be a big thing. And if you're a busy mom, you're like, oh, I'll get to somewhere and I'll buy something. And then you just never get around to it. There's like, you have some stuff in your basement probably that could be made to work. All right, so then we're going to use the band to do some overhead pulling. And so I'm going to give this to you. This is this one here. So the weights don't really work on this one. Vertical pulling is harder to get because of the nature of it. You have to pull down against resistance. So if you have a band, you're just going to grip somewhere on the length of the band that allows you to keep your elbow angle pretty much the same. And you're just squeezing down right there into the shoulder blades and then releasing and coming up. So that's building some different muscles in the back and shoulder by doing that. So those
right now while you're pregnant, let's talk about like the exaggerated curve you get and why it's important to have a strong back and core, because that supports you, right?
So like, even while I'm doing this, I have a tendency to like lean back.
So you can always stagger stance.
Stagger.
And that kind of helps you reset so you don't tend to do that.
A lot of people say they have back pain after delivery and they attribute it to the epidural, but it's really just because they were pregnant and had a baby.
Yep. Yeah, the back can take a little bit
so if you keep
of
your
a beating.
back strengthened, then that can help reduce the discomfort you have after you've delivered.
Yeah.
And during all of these exercises, like trying to focus on keeping your core tight too to support your back while you're doing these.
Yes.
Yeah, that's a great
Super
tip.
supportive. If you kind of just think about sucking in a little bit, like if someone's walking by, you're trying to impress them, just a little bit of tension pulling in.
And your abs didn't disappear when you're pregnant. They're still there. So,
Yes.
yeah, still important to work on and use them.
It totally is. And so those are our 4 exercises. Super simple. Push up, 1-arm rows, overhead press, and pulls.
A lot of people may have done like bench presses before they got pregnant, but you shouldn't be on your back after about 20 weeks of pregnancy. So is there a modified way to work the chest other than push-ups? Is that the best way?
That really is the best way.
Yeah, because you don't want to be on your back.
Yeah. And chest presses are a great way to challenge your upper body because they're an open chain. It's like you have to control this weight above you. But it does put you at more risk for injuring something because you're holding this weight above your head and you're having to control it. So push-ups are a closed chain exercise, which the ground hopefully isn't going anywhere.
Right.
And so it is much safer in the shoulders. And obviously, once your baby's a certain age, usually around 20 or so weeks, you shouldn't spend extended time on your back. So push-ups are a really great alternative to work the same muscles like a bench press would do.
So along those lines, can we go to the core exercise now, since you're not supposed to be on your back? What do you do
we
for
can
your
jump
core?
into the core. Let me just refer to my notes so I remember what order we were going in. Okay, we are right ready for plank. If you guys are familiar with plank, it's an isometric exercise where you're just going to hold your body in a line. And I'll talk fast while you get in position.
Just tell me when I'm good.
I'll tell you when to actually get in position. But again, an elevated surface like this is going to make it easier. If you can do this exercise just on a mat on the flat ground, even better. A lot of people who aren't very far along in the pregnancy yet can do this without an elevated surface. But it's the same issue with push-ups. Once your belly gets to a certain size, it can be hard to do the plank just because your belly is interfering.
Without touching the ground.
Yeah. So if you have an elevated surface, then you can do plank like this. And so if you don't need a step, you can just imagine the same form, just straight on the ground. So she's just going to get onto her forearms and then put her weight into her toes and her forearms. The thing that's really great to remember is you want a neutral neck. You want shoulder, hip, heel to be in this really nice straight line. You're going to want to really suck in your belly towards the spine because you're, instead of pushing out, some people tend to push out with their abs in this exercise, which is not helpful. You want to pull in because you want to build those deep transverse abdominal muscles. So
you
pulling
don't want
in
your back to sink because
right
to hurt your back.
And if Cassandra, go ahead and like raise your hips up a bit. Some people, when they're getting tired, kind of raise their hips more and more, or they'll droop. When you start to feel your form cave, then just be done. Yep, so you're good. So 30 seconds is a great goal, but let's say you try these and you're like 10 seconds, 15 seconds is all I got. It's a great place to start. Don't hold it the whole 30 seconds, like I said, if you're starting to lose form, because then it's not helpful to you and it's more potential to cause injury if you are holding this in a way that's pulling on muscles that are really not intended to be used in the exercise.
Yeah,
so
right.
The nice thing about doing the planks with somebody coaching you is that they can coach you on your form.
Yeah, go up, go down, straighten
and
out.
we call out the time, halfway done, 5 more seconds.
5 more seconds.
And even if you don't have a coach, you could just get with a friend.
Yep,
and do it
Exactly.
together. Yeah.
And then I like to have it's kind of great to have the timer right there because then you find you're looking at it. But at least to know you can check in and say, okay, it depends on your personality type. I've gotten to the point where sometimes I like to have it away from me, so I'll hear it ring when it's done, but I don't like to watch it necessarily going
Tick
down. But if you're kind of where you're not comfortable doing a whole 30 seconds, it may be good to have that timer in front of you, and then you can kind of see as you get more able to hold it longer and longer, you can kind of see that gradual improvement.
Right.
So and aiming for 30 seconds is good. Okay, I'm going to just kind of slide this.
Is it bad longer than 30 seconds?
No. Most women probably will feel a little bit challenged at 30 seconds. But if you've done planks a lot and you're able to do them, you can go a minute, however long till you feel like you start to lose your form.
So, being a physician, can you talk to us about diastasis recti for a minute? Because a lot of people have questions about that, and do ab exercises during pregnancy help that?
Yeah, so diastasis recti is when your rectus muscles get separated during pregnancy, which they naturally do. And then postpartum, some women have a hard time getting those rectus muscles to come together. So if you have more than about a 2 to 3 centimeter gap between your rectus muscles, which are kind of your six-pack muscles right here, you essentially have diastasis recti. And it can lead to problems like back pain, and you constantly have that like mommy pooch instead of your abdomen being really flat if you have that. And so keeping your core strong helps reduce that separation or get it back to normal after delivery. And what you really need to strengthen is that transversus abdominis muscle, like Shauna was talking about, that muscle where you really try to squeeze in your belly. Focus on squeezing in your belly.
Let's just move to that one right now, since we're just talking about it. So that is the really deep muscle that kind of acts like a girdle around. It goes from your spine and all the way around. And so if moms are having a hard time with a large gap in the rectus muscles, usually that can be helped by strengthening and tightening the transverse, because then it allows those rectus muscles to reapproximate a little bit better. And so the plank is a great one if you really focus on pulling in your belly button to spine during the exercise. That means you're working your trans, which is what we want to work. If you find that is too difficult to do, or you find that you're just kind of pushing out with your belly, I would forego planks, because we don't want to do anything that's going to put more pressure on the rectus.
You can actually do more damage than good if you're doing the wrong exercises.
Exactly.
Right?
So if your core is super, super weak, and maybe your trans abdominis is really weak, planks may not be the best place to start. But this one is a really good one. Anyone can do it, so I'll do it too. But it's just basically, you'll set your timer for 30 seconds. You will pull in your belly button to spine and hold it for a few seconds. Squeeze it tight, 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 and then let it go. And then pull it in and squeeze it tight, 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 and let it go. And you'll just repeat that for your 30 seconds. You'll feel that difference.
Seeing your cute little belly.
Yes.
I'm really doing it. I don't know if you can see it, but I really am doing it.
And so the trans abdominal squeezes is what I call them. You can do sitting, you could do standing, but it does help strengthen those deep trans muscles, which and you're just working them in isolation and not putting any stress anywhere else. So if your core is super weak,
helps with that too.
Yes.
If you're standing up straight, you're kind of naturally doing that too.
Mm-hmm.
But we all kind of have a tendency to slouch.
Yes,
yeah.
so true. Another kind of, I didn't actually have this planned ahead, but as pregnant women, a lot of times we do tend to lounge on the couch. Mm-hmm. We tend to not sit up straight because we're tired, you know? So, but a way to maintain good posture and kind of keep those deep abdominal muscles firing a little bit all the time is to sit either on an exercise ball while you're watching TV. If you have one of those big yoga balls, it really makes you sit. It's really hard. I mean, you can slouch on those, but it doesn't feel right
too, because you kind of like get this exaggerated curve for a second that stretches it a little bit.
Yeah, so either that
pressure,
or just sitting in like a crisscross seated on the floor position called a Taylor sit. Also kind of does the same thing. You can slouch in that position, but it just doesn't feel natural. You tend to want to carry your rib cage up where it needs to be, shoulders back. And so those are things that you can just do every day. So if you've got a desk job or you're at home a lot sitting, thinking about how you're sitting, and maybe when you're watching TV, either sitting on a ball or sitting on the floor is maybe a better place than just
two
like
birds with one stone
on the couch. Yeah, exactly. So
any other ab exercises? That
yes, a couple of other ones. So we're going to do the fire hydrant ones. So you can get down on the floor too, Dani, if you want to, and you can follow Cassandra. I don't know if you've ever done this before. It's kind of fun and goofy.
It's the circle one.
Yes. Okay. So you're going to be in a table.
Am I in the way?
I don't know.
Is she going to get me? Okay.
I think you're good. So you're just going to be in a like tabletop position, hands and knees, and you're going to take your bent knee like you're trying to like make a little circle on the ground. And you're just going to rotate for 30 seconds, making circles in one direction. When that 30 seconds is over, then you're going to switch directions. So you go ahead and switch. So you're going to do 30 seconds of that direction. The whole time, think about holding your tummy in tight. And then when you're done with that side, you've had a minute of combined time, then you'll go to the other side. This doesn't look like it's doing much. But
you feel it in your butt, your hamstrings, your abs, your shoulders.
It does get the glutes, and it does get the hamstrings, as well as making you, because it kind of sets you a little off balance. You have to stabilize. Your core kind of gets brought into it because of that. So this is usually a pretty well tolerated exercise for ladies who are pregnant. And it's pretty effective. And then the last one I wanted to show was the bird dog. Are you familiar with that one? So it's the same kind of thing. We're going to kind of create a little bit of instability, so your core has to kind of pull in and activate. So you're going to take opposite hand, opposite leg off the floor, reaching toes to one wall, reaching fingertips to the other wall, hold it for a few seconds, and then switch sides. Obviously, there's lots of ways you can do this. You could hold that one side for a minute. Most people, unless you've done a lot of yoga or something, are probably not going to be good at that. The biggest thing is to just try and keep, as best as you can, your hips in line. Try not to rotate out at the hip. And you guys can just go back and forth to your comfort. But that's all that is. And so it's kind of creating a little bit of challenge for your core to keep everything stable and locked in. So that's what the bird dog does. And if you find this is really difficult for you, you can even just do one hand off and back down, or one knee off, until you can do opposite hand, opposite leg. So those are the core ones that I prepared, and I think are usually pretty good for everybody.
That's great. We're feeling it. Woo! So how about legs, lower body? And when you work your lower body, you often get a cardiovascular workout because that gets blood pumping through your body. So that's helpful too.
Yes, it usually does elevate your heart rate more than like the upper body stuff. And it's just because these big muscles require a lot of energy. When we're asking them to do something, the demand metabolically is enough. Our heart rate usually has to rise to meet that demand. And so it's really good. So I wanted to start, we'll kind of pull in this chair a little bit just to show. So squats, I'm going to have you stand in front of the chair. Squats are a great exercise, but for people who haven't done squats maybe for a long time or never really at all, it can be hard to get the form in the way it needs to be And so I usually set a chair or a bench behind the ladies so they can feel comfortable with doing what they need to do. So sitting back and really focusing your weight into the heel. So if you have a chair back here and you're really focusing heel into the heels, you know there's a chair to catch you if you kind of lose your balance backwards.
Yeah.
So,
and it helps you have better form.
Mm-hmm. So if you just like go, I'm just going to go to the point where my butt touches the edge of the chair.
Chair will listen. There we go. Okay.
Yeah. So just doing that, setting
That's
the timer
perfect,
again for 30 seconds, and just focusing the weight into the heel, sitting back, getting those buttocks back as far as you can, and standing back up. This is really
good. And you do
good.
a little squeeze at the top, too.
Yes. If you do a
Add
little, buttock
extra
squeeze.
something there, yeah.
Yeah, it does. If you, at the top, if you do a little buttock squeeze. Just a little bonus. Absolutely.
Squeeze, yeah.
Exactly. And so for most people, body weight will be sufficient for the whole pregnancy. But if you're really well conditioned, maybe you've got a strong lower body already, to hold dumbbells at the side, you can add resistance that way, or up on your shoulders, if you're used to doing that. But most people do pretty well with just body weight only, and it's 30 seconds.
You're quickly gaining in the front anyway.
So. Increases. So.
Yeah, what were you saying the other day? You're like, it doesn't feel like this really gets any easier. And I'm like, it's because you're putting on resistance every time I see you. There's a little bit more of yourself to move.
That's a great way of putting it. I'm putting on resistance.
Yeah. So usually you don't necessarily feel like these get a ton easier. Because your body's just in this constant dynamic flux, which is awesome.
Right.
I think pregnancy is such an exciting time. And it can be difficult with training because your needs do change a lot during the course of the pregnancy. But it's one of the reasons I love training pregnant women is it's fun. And it makes me think, and it makes me have to come up with solutions. It makes me just really engage with the client. So I love it.
So what other lower body exercises?
So front lunges are another one. Lunges where you step out and go down. The biggest thing is, remember, your back knee is really going to sink down straight. Imagine if you're just someone's pushing the top of your head and you're just sinking straight down. So you're going to want to keep that type of form. Now, how deep you go is completely up to you. So if you've not done a lot of lunges for a while, you will feel these like 2 days later. So if you push it really hard for 30 seconds and you've not lunged in like 2 years, you may hate me as you go downstairs for like 2 days. So just be a little bit conservative in maybe the amount of reps you do in that 30 seconds or how deep your range of motion is. You don't have to go down.
You can really change that. You can just go down a little bit and feel it, or you
can go clear down to the knee touches, barely kisses the floor. Yeah, so there's a lot of variation on that. So you're gonna do lunges like that on one side and then the other. Or if you're
30 seconds.
Or if you're really deconditioned in the lower body, you can alternate feet.
Which almost gives you more of a cardiovascular.
So you can alternate, or you can kind of do like a split squat or stationary lunge by staying on one side.
What about like holding and pulsing?
Yeah.
Do you recommend that or no?
You totally can. It's harder. You'll definitely feel it. So if you feel like you need a little bit of a challenge, maybe in the last 10 seconds, either doing little pulses, or you can just isometric hold, and that can be a fun time. So there's some ways to challenge yourself if you need a more challenge too. So front lunges are really great, but remember to use your common sense about how deep you go and how fast you crank them out if you're new to doing them.
I mean, I've had to modify it a little bit because at the beginning of pregnancy, I was doing alternating and going pretty quickly at them, alternating legs. And now I find if I stay on one leg, I can do more reps, and it's still challenging, but I just stay on one leg and then do my reps on the other leg, so I'm not alternating back and forth.
Yeah, well, and moving too quickly and putting yourself off balance when you're pregnant may not always be the best thing if you're not used to it, because you certainly don't want to fall and get hurt.
Right, especially as your belly gets bigger and your center of gravity is more off. So yeah, she's found that that's been a great little modification that's really worked. And so, yeah. So the front lunges are great. Plies are the next one that work inner thigh. And so they're going to look a lot like squats in the fact that you're just sinking down and going up and down, but you're going to angle the toes out. You'll want your knees to track in the same direction as your toes. And you're going to sit down here, get as low as you can, and then come up. You can do the same thing where you can squeeze the buttocks at the top. Yes. So this would be, like, again, your best effort for 30 seconds. Now, if you're like, these don't feel super challenging to me, or maybe you start doing this in a couple weeks in, you're like, this doesn't really feel like I'm getting as much out of it. Down here, you can raise one heel and then come back up, or both.
Or go and hold it. And
The heel lift just basically makes you iso hold for a second, and that will intensify it for you. So getting inner thigh, super, super good. Because sometimes that's a hard area to just get worked normally. Then lateral lunges. These are good if you are kind of spread toes forward. So not like we just were angled out. You want to be toes forward. And you're going to sink into this, hip.
booty back.
Booty back. Yes. How far you sink down, again, you have total control over that. So if you're just like a little tiny bit, that's fine. If you really want to sit back way far, again, concentrating in the heel of that foot. And you're going to just do your best for 30 seconds, and then you'll switch. The big thing is you want the one leg straight. Where this one's bending, my left knee is doing the bending, my right leg is straight. So that's kind of the lateral lunge, which is kind of a fun lunge variation that I think is a good one. So I'm going to just wet my whistle here really quick.
I know now that we're doing these, we're starting to feel it.
So I think the last two we're just going to show on a mat because they're on the ground. And then the exercises themselves, we are going to be done showing them. We can talk about some of the stretches that we'll do. Okay, so this one's called clamshell. You'll probably figure out why in a minute. So you'll lay on your side, and you'll have your knees bent kind of in front of you, just like Cassandra showing Dr. Foss does these really well. So you're going to keep your feet together, touching, and you're just going to open up at the knees and come back down. These are pretty good without any extra resistance, but if you were like, this is not really challenging me at all, to add a knee extension at the top and then come back down will add more challenge, which is good. Also,
working your outer thigh.
Yep, outer thigh and hip. Bum, absolutely. If you happen to have one of those loop bands or those TheraBands, you can shimmy that up right about your knee, and that will definitely give you
add some resistance.
That'll give you more resistance. But that's not necessarily something people have hanging around. But if you do,
go for it.
Go for it. So you do your best 30 seconds on one side, and then you'd switch sides and do the other. But I think we're okay. I think we've seen. We don't have to show the one side. The last one is these donkey kicks. So you'll be in the hands knees position. You're going to just kick back and aim your sole of your foot for the ceiling.
I'm going to do this side.
You're going to it'll be more easily seen. More easily seen. So you're just going to really focus into the hamstring and the glute and push that heel up and come back down. Now, again, if this doesn't feel like it's challenging you a lot, maybe the last 10 or 15 seconds, you could hold it elevated and pulse it, which will do more.
Definitely.
So
you'll feel that.
Yeah. So if you start out with just doing a full 30 seconds of the full range of motion and then find, that didn't seem like it was very hard, you can end the 30 seconds with going with the holding it high and just pulsing up and down. But the thing I want to point out is the duration of this 30 seconds is just a starting point, and you can go longer once you kind of get the strength and ability to do it. And you can kind of combine and mix the exercises that we showed today. So if you have a couple of days a week where you're like, I have a sitter or somebody that comes home from work where I can like dedicate 45 minutes or an hour, you could combine all these exercises we just showed and do a full body total head to toe workout. You can do everything one time through if you're just starting, or maybe go 2 or 3 rounds, whatever you have time for and what your body kind of dictates. But let's say your time is more chunked up. You can do a little something every day. So you could rotate between upper and lower body every day.
You might be sore, so you might want to.
Mm-hmm. Yeah. So it'll be nice on those days where you're really feeling the lower body from the day before. You're like, well, today I'm doing my arms, so that's okay.
Yeah.
And then throwing in those core exercises with whichever one you can, or maybe rotate between all 3 throughout the week. But that is such a good starting point. And then if you have time to go for walks or to do other type of more outside right now is not a good place to be to exercise with the air quality is hideous.
Right, yeah.
But when it is good outside, getting outside to walk, or getting to the gym if you really love that elliptical, do that too. Swimming. You found swimming's been awesome for you.
That kind of lifts everything up too and can make you feel a little
My back always feels more loose and not quite as tight after I go swimming. So.
Yeah.
Yeah. So those
Are there any
great
cardiovascular exercises a pregnant woman should not do? Like, I remember one time I had a woman who came in for her 39-week induction, and she ran 5 miles that morning. And we were all like, good for you. And I mean, she'd been running like, 10, 15 miles almost every day prior to getting pregnant. So 5 for her was nothing. Mm-hmm. But for the average person, would running be a good idea or not so much?
If you're not a runner, I wouldn't recommend it. But runners,
you can
if
keep
you run
doing it
avidly before
the
pregnancy,
jiggling isn't going to hurt the baby.
You can run
or hurt
during
you.
pregnancy. No, it's not going to hurt. So.
No, and some women find that they can do it throughout, and then some are like, I've run like since I was 21, and now the belly shake bothers them.
Yeah.
Or they do one of those external belly bands, and they still feel like
just too much jarring.
Yeah, it's just too much jarring, and they decide to cross-train, do something else.
Mm-hmm.
But I've known some pregnant women who've run throughout their entire pregnancies who continue to feel good, so it's like,
why not?
Why not? Exactly.
So let's talk about
pregnant women run half marathons.
That's
exactly. I've known a few of those too, which is awesome.
Yeah. So what about listening to your body? Because, the signs associated with preterm labor if you're preterm or contractions if you're full term, it's the same thing. Lower abdominal cramping, lower backache, abdominal tightening, pressure, and sometimes you can have pain in your thighs. Mm-hmm. So let's say you just did like a really intense lower body workout, and the next day you're like, oh gosh, I'm feeling a little crampy, my legs kind of hurt. When do you know if it's concerning or not?
Really when it's more all those signs together. So if you're feeling a cramping and a tightening in your stomach and your uterus with back pain, with pelvic pressure, with thigh aching at the same time, and it's coming and going, more like a contraction would start and build, get stronger, and then relieve itself. Pay attention to the signs and if they occur all together. But if it's just, my leg muscles are sore, that's okay.
You can keep
my
working
back
out.
is sore, that's okay. Sometimes you will feel tightening here and there when you're exercising or being really active. But as long as not all those signs together, and especially if it's a contraction that's really taking your breath away, then that's more of a concern.
I feel like you have to stop.
Yeah. But definitely pay attention to your body and certainly stop what you're doing if you're feeling uncomfortable that way. And rest and relax and see if those symptoms are going away.
Hydrating up is really a good part of doing that, emptying your bladder, resting. And
not
those
getting too
symptoms
overheated.
Yes.
And how high is too high to get your heart rate during pregnancy?
There's really no limit.
There's no upper limit. No. There used to be. They used to say 140, but that's not been the case for like 20 years.
And I'm like, no, it's fine.
So
just as long as you're feeling pretty good.
Yeah, the RPE scale, ratings of perceived exertion, is really what everybody's talking about. You can also use the talk test. So if you're so breathless you can only say a word or two at one time, then that's probably a good indication that maybe your heart rate's a little bit elevated more into like maybe the vigorous area, because we're wanting moderate exercise for pregnant women in general, unless she's like really been used to pushing it more vigorously. And then if she's used to doing that, her body's probably accustomed to it. But if you're really coming into exercise kind of newer in the pregnancy, you want to feel somewhat winded. You want to feel like you're working. But if you're so breathless you can barely talk, that's probably a good indication to slow down or pause your exercise for, 15, 20 seconds. Let your heart rate kind of come down until you feel like that breath return and you're breathing a little more easier, and then come back in. But, 0 is like no exertion at all. 10's like my lungs are going to explode. My heart's going to beat out of my chest because I'm trying to run up this hillside at my full on speed, So we definitely, we want to be somewhere around 4 or 5, maybe pushing 6 on how much you feel like you're really pushing yourself. But the heart rate thing has really been shown to not be an effective way to track what's moderate exercise, because everybody's so different. So just go
I think
how
that's
you
helpful
feel.
information. Back when I had my first 10 years ago, the doctor was like, don't let your heart get over 140. So I'm on the elliptical. I'm like, I'm not even working that hard. And
This feels kind of lame. Exactly. So yeah.
Okay, well, are you guys up for some questions? We've had a couple of come in. Let's see. Jessica says, exercises for back injury. What if you have a back injury? How can you modify?
I would say if you've had a known back injury, you've probably, hopefully been seen with a chiropractor or a physical therapist, and maybe had been given some exercises to do to help rehab your back.
So maybe that's something you should get tailored information and advice on, because they know what the back injury is and what your limitations would be.
Mm-hmm. You can talk to your OB doctor. I mean, I've recommended plenty of patients go to physical therapy during pregnancy. And there are a lot of women's health physical therapists that work with women specifically during pregnancy for back injuries or pubic symphysis separation, a lot of different things. And so working with a professional might be recommended if you...
Yeah, I mean, if you're not having pain right now, if you start off what we did fairly conservatively, maybe the easiest stuff, and if that doesn't bother, then just kind of gradually listen to your body and use your body's wise. It knows what it can handle and what it can't. So as long as you're not feeling like any red flags are going off, you're probably okay if it's just a history and you're not having any current problems. But I would definitely say there's so much help out there for active problems that you can get. So you don't have to say, well, my back hurts, so I guess I'm just...
That's an excuse
I'm
to
SOL
not do
all
anything,
pregnancy, right?
Yeah.
No.
Yeah.
Yeah.
So a couple of messages I think we've heard is get off the couch, do something, because you should exercise during pregnancy. It's good for you. And if you haven't done anything, just start by walking. You can just start by walking like 15 minutes a day, work it up to 20, then 25, then 30. Intermingle strength training on a couple of days a week.
Right.
And listen to your body. Make sure that you're not overdoing it. If you start bleeding or cramping, then you need to stop what you're doing and call your doctor. And I think these are some great tips and advice for everyone, really, whether pregnant or not. Like after you've had the baby, and
you can do this exact
you can do the same thing.
You can do the
and
exact
you would
thing.
have had like a 6 to 8 week break, depending on your mode of delivery. And so, getting back into it, you may find that you've regressed a little bit. So you'll find some satisfaction in building back up and exceeding the goals you had during pregnancy.
Yeah, I mean, what we've shown, anybody could do. Your husband or boyfriend or whoever in your life could do this with you. It will benefit them as well. But
That's a great idea, involving your partner, because then you can make it a competition. It's fun.
Yeah, and a lot of times I think sometimes dads do the whole eating for two thing, even though moms shouldn't even do it. Sometimes dads do it, and they have some sympathetic weight gain.
They don't get the immediate weight loss with baby and placenta and fluid.
No, so I think it's so important to kind of create an active lifestyle in the family period, because your baby, as they grow into childhood, it's so good to see active examples in their life. And so this can be a really great jumping off point if you haven't been exercising before. This is such a critical time to initiate exercise and then keep it going. There's so much it can do for you. So don't be afraid of it. There's resources out there. And
if people want to learn more from you, where can they find information about you?
Yeah, so I have a website and a blog, miamamafitness.com. That's MIAMAMA. You can spell mama a few different ways, but I spell it M-A-M-A, and then fitness.com. And so there's a contact box. Like, I love to entertain questions, or if I can be a resource or a help to anybody, you can email me through there. And I do have a Facebook page too that you can look, same name. You can look up Me and Mama Fitness and find me there. I'll probably be posting today's live once it's
streamed there too.
Yeah, so people can see that there. And that's how you can get a hold of me. So if you're really having questions or needing some help or guidance, I would love, if I can help a mom be active who otherwise wouldn't be, it would thrill me to death. So.
And what about you, Dr. Foss? Where can people find out more about you?
Yeah, so I work at Wasatch OB/GYN Clinic. It's at McCady Hospital and the Intermountain Layton Clinic. You can go to our website, wasatchobgyn.com or intermountain.com, and search for Cassandra Foss or Wasatch OB/GYN.
Everyone who's ever had you as a physician is dying now and thinking it's so awesome to see you here. I think it's great that you guys have come with us today.
Yeah.
Thank you so much for being here.
Yes, thanks so much.
And of course, if you guys have questions in the future for me, you know where to find me on Facebook at facebook.com/Intermountain Moms. Have a good day, guys. Thanks.
See ya.